A few things, yes, we need to talk about.
But Ritu, I'm muted suddenly.
Yes, sir. I think it was nice presentation, and the Keshav support has made this session very comfortable for ma'am, and for we have already know all these things, but when we are learning from our colleagues, our classmates, that it gives us a uh, great pleasure. I was feeling so happy that when ma'am was explaining where she has started with the Maitland and Malignant, where from static to functional demand, where we can give the lights, then we can give the mobilization with movement. If there is a restriction in between coming with the fascia, we can release with the myofascial release technique. We have like either with the direct, with the specific, with the gross, all the content we can use. Like in a picture you were showing the leg pull, that was the gross myofascial release, where we can use the far away part for the body if the patient is having a pain, or near about the region that there is a pain, we can use the specific myofascial release. And the direct, which you have shown on the piriformis, by keeping your hand on that particular joint, the muscle, the piriformis, the direct myofascial release. Or we can change it as a active participation of the patient with the motor control, and with the muscle contraction with the fasciomuscular release, where we are releasing the fascia with the muscle contraction. That is active participation. That is also a very excellent approach of AOMPT, in which we are not, because myofascial release, that is a passive point of treatment, which is all the physiotherapists know about that. But when we treat our patient in an active participation, that is the goal of AOMPT. Your patient should be participate in your treatment plan, so that he can feel that which area, which muscle is going to contraction. And if we are going towards the neural, we can add like the orthomyoneuromanual therapy, where we have kept the foot in that particular position, either in a femoral nerve or in the in a sideline position with the sciatic nerve loading. And that time we can give the treatment for the piriformis, the pseudosciatica. And if there is a joint there, we can palpate the lumbar spine also. Because of that, we can the articular, and we can release the fascia. So these component, and we cannot forget in that motor control, the core stability of the patient. So this is also an excellent approach, the orthomyoneuromanual therapy. And these are the thing. And the if we want to add the adjuncts, where you have shown with the screw cupping, that is also, because in a screw cupping, it is a flexibility that we can release the pressure, or we can add on the pressure according to the patient convenience also, because that we are treating the patient in a patient centered approach. Or the we can use the static screw cupping, we can use the dynamic screw cupping, and we can use the functional, which you have already shown, by taking the muscle in a lengthened position that time. And in the simultaneously we can use the ISTM also. So these you have combined in a one session. That is also a very helpful to you, that you have made it so simple and very easy, because we know everything, but the other participants who are new here, they can easily understand that when and where we have to use this. We are not like the masala therapy, we are not going to mix all these ingredients. We have to use step by step. If there is a patient is having a pain in the static position, the symptoms are constant or the intermittent after differentiated, then I will go for the Maitland glides also. If the patient is having a problem in a functional position, where I will choose the Mulligan's, either with the Mulligan belt and the mobilization with the movement. If the patient is having a spasm or the tightness, I will use my treatment with the muscle energy technique. Or if the same side muscle is in a pain, I will use the isometric, post isometric relaxation. And the if the patient is having a spasm, not allowing you to touch that particular hip region where the buttock sign is coming, so I will start my treatment, first rule out the spasm, then I will go forward for the other treatment. So this is also a very sequence which we learn in a AMPT, because we are learning in a sequence pattern. So we can understand that what is the goal of my treatment plan, where I have to start, or where I have to give the comfortable position to my patient. Like in a figure of 4 position, in the prone position, where we offload that particular area, where the sciatic nerve loading to offloading that particular, because of that flexion we have kept in the extension position. if the patient is having a abduction problem, so I will keep in the abduction position. That time I can, like you were showing, that we can add the pillow in that also. And that time we can say that patient that you just push the pillow. So that is also a reciprocal inhibition. And at the same time, I can check, palpate, and can check the tunnel sign also for the nerve, or I can give the myofascial release also. So these are the things I would like to add on in this session, because so that the other participant can understand that our treatment is not like that. Simply, we are not applying the electronic modalities for our patient. We go thoroughly, because whenever the patient comes, first our treatment in the PRT, the positional release technique, where we keep the patient in a, because sir always says that if there is a aggravating factor, so there is also a one relieving factor will be there. So we have to find that what is the position which are going to relieve the patient. So I will choose that particular position for the relief of my patient. Then I will start my treatment. So that is our goal in AMPT. So we are not going to worsen any symptom. So according to that, my manual therapy will be suitable, or like functional neurostabilizing technique, where the FNST is also, we can train the patient in the, for like sports person, they need that fast recovery. So there is a FNST is a very fast approach we can use for stabilization, the muscular stabilization with the neural positioning also. So these are the things which made AMPT in a very different state, because we cannot say that we are like all physiotherapists, we start our treatment with the TENS or IFT. We have on our physical examination, evaluation, assessment, then we move forward. And even sir always says that our first session should be only evaluation, and during the evaluation assessment, you do something like this, your assessment, that patient gets the relief 10 to 20%, so that they can feel that the hand of my therapist is suitable for me, so that he can come back happily tomorrow also for the next session. So thank you so much, ma'am. All not for the today's session, that you have clear the hip joint, all these things with the anatomy to biomechanics, pathomechanics to physical examination, and with the final closing session today with the manual therapy, how we can treat our patient. So it was the sequel 5 classes. So if the people who are will see this video and they will purchase this course, they can easily make their grip strong on the hip region, so that they can easily understand first step, second, third, fourth, and fifth, so that they can easily evaluate. So that it is good for all the clinicians when they are going to treat the hip region, because there is not only the hip region you have explained, you have the kinetic chain also explained, how the ankle movement, how the knee movement is giving the dysfunction in the hip, how the gait deviation we have to check. So all we have completed in a 5 days. It was your hard work, which you have explained with the guidance of sir. And really, it was wonderful. Really, I have enjoyed, and I hope all have enjoyed this session, because it's a making a step-by-step decision of the hip joint. So thank you so much from my heart, ma'am. And thank you so much, sir, for giving us this opportunity to learn from Darshana ma'am also. And really, it was nice session. And thank you to all the participants who are there, present there, not on the screen, but off the screen. But thank you from as an executive or admin. I want to say thank you to all of them, that they have enrolled in this course, and we want to see them in a further more courses, so that we can learn together from them also. They can also come with the case study, they can also come with their topic, they can also take the webinar with the AMPT, so that we can learn from them also. So thank you so much, everybody, and thank you so much, sir and ma'am. Thank you, sir. Over to you, sir. Yes, sir.
Do we have questions? Anything on the chat?